Most children with cystic fibrosis go to hospital at some time. If your child is about to go into hospital for the first time, you're probably wondering what to expect.
When we first came in, we didn't really know what to expect. We didn't know what the procedure would be. We didn't know. We had lots of questions. It was more scary, I think, for myself and my husband than it probably was for Lila.
My daughter was very young. She was hospitalised when she was 1 first off. So it was quite a first of a shock coming in.
I think for first-time parents, when the child has to be admitted into hospital, is for them to be aware that they're going to have lots of different emotional reactions about the reason for the child being admitted into hospital. Yeah, there's going to be a lot that's going to be happening, and it's important that they know what's going to happen, in a sense that trying to make things as predictable as possible.
One of the things is to always ask questions. Ask as often as it takes to get things clear, but it's just making sure you understand what's happening, you feel like you have some form of partnership in everything that's happening. So I think asking questions.
This video will help you prepare for your child's first admission to Princess Margaret Hospital as effectively as possible. You'll be called by the admission centre, who'll give you details about your child's admission. It's important that wherever possible, your child attends the hospital on the day and time they're assigned. The hospital's admission centre is in the foyer on level 4. If you arrive after 2:30 p.m, report to Admissions Emergency West. All the paperwork will be completed before you arrive on your ward.
Just do a name band. We'll just fix this on Rosie for a minute.
The lifts opposite the shop and cafe will take you to the wards. Babies up to 12 months old will usually be admitted to the baby ward. Children up to 13 will usually be admitted to Ward 9A. And teenagers will usually be admitted to Ward 17. When you get to the ward, the nurse assigned to look after your child for the shift will take him or her to their room to do a nursing admission.
So we'll be giving Lila her medications and her antibiotics.
A name band will be put on your child's wrist for identification. Your child will then be admitted by a resident medical officer, or RMO. This is a junior doctor assigned to the respiratory unit. The RMO will take your child's medical history and then plan and chart the medical care required during the admission.
Parents often want to know how long the admission will take. It's usually around 2 weeks to treat an exacerbation of cystic fibrosis, but it does vary from one individual to the next and one exacerbation to the next. So we'll be evaluating symptoms every day and other targets. We'll know as we go how long it will take. It's very important to complete the admission until the very end. When we stop treatment prematurely, it can set us back for months. You won't be stuck in a room for 2 or more weeks. There will be time to go to the park or go out of the hospital or go out for lunch.
Yeah, it's been good this time in. We are able to leave the ward with Emily. She can get permission from the doctors and the staff to do that. So we can go off and meet friends. Emily had a picnic on Kings Park on the weekend with some friends, so it broke up the day.
The big thing is just to not miss treatment or not miss any procedures or consultations. So parents just need to check with the nurses or the medical team when it's okay to leave.
To help your child settle into hospital, bring any favourite toys, books or DVDs that might help. Bring all their toiletries and the clothes they'll need, including nightwear.
If the decision's been made for your child to come into hospital, I'll hand over any information that the ward physiotherapist might need to know about your child's airway clearance program. But what we would like you to do is bring in any of the equipment that you use at home, so things such as a respiratory device like a PEP mask, Any of the toys that you regularly use with airway clearance, like a blanket or an iPad or a timer, things that might make your child feel more comfortable in hospital.
Let your child's school know about the hospital admission. They'll give you work to bring in for the PMH ward school teacher to supervise. If you bring any electrical and electronic equipment or gadgets, they'll need to be safety checked by the hospital before they can be used. Please be aware that during the admission, personal items and clothes are your responsibility. All meals will be provided for your child. Your child's room will have an ensuite bathroom and toilet. It also has a fold-out bed for whoever is staying over with them. There are laundry facilities on level 3 for personal items while your child is staying at the hospital. Please leave enough time to find parking before your admission appointment. You may be entitled to receive a parking voucher for the PMH Visitors Parking Bay. Talk to your social worker to determine your eligibility.